With regards to, of course, whether to treat Parkinson's disease with stem cell, of course, we have to have, as a doctor who treats patients, I need to know, of course, the history, the medication that's being given to and the amount over the years, and whether there's any also side effects of the medication. As we all know, because Parkinson's is an ongoing degenerative disease of the brain, even increasing the medications or adding on new medications do not sometimes work at all. In fact, as we increase the doses, the side effects come on. So we are in a lot of doctors and the patients and the families are in a difficult situation. Hence, at least we have the alternative of adding on stem cells. All right. And over the years, as we have enough experience, not only here and everywhere in the world, and also for other medical conditions, we know that stem cells are very safe. It's unlike the Parkinson's medicine. The more you give, the more side effects you have. So, but stem cells, even though we give on, the more we give, situation tends to improve. But of course, we know what is a safe dose to be given at every time of the treatment. So it's unlike the oral medications where you can come to a dead end where you can't give anymore. All right. Now, stem cells can be given on a regular basis, whether it is 6 monthly or on a yearly basis, depending on the improvement. And the number of exosomes can also be given on a regular basis, either in the hospital or nowadays we can actually supply exosomes to be given at home, which is very convenient for the family to continue treatment. Now, with regards to the stem cells, there are basically two ways of giving the stem cells. It is either just purely intravenous through the veins or in combination with the intravenous route and the spinal route, which I will occasionally do depending on the wishes of the family or depending on the condition of the patient. The spinal route is a minimally invasive way of injecting a product or a medicine into the spinal fluid, which is actually in continuity with the brain. So the spinal route is like a shortcut or a quick route to the brain, all right? And with that, we hope to deliver a certain amount which is safe for the brain to start repairing itself. We will talk about the side effects of a spinal later. Now, with regards to intravenous, of course, intravenous, not many of the cells can enter the brain, which is well protected by a barrier. Hence, at least we have another alternative route, which is the spinal route. Right? Now, the spinal route is actually a very safe route. I mean, I am a trained anesthesiologist for more than 35 years. I've given almost 20,000 injections in the spinal area, and I have no problems at all, even up to now. And to me, it's a very safe, very, I would say, fairly easy to do procedure, which can be done in less than 15 minutes without the need of any special equipment except for just a simple needle and a sterile environment. And in adults, we don't even need to sedate or to put the patient in a very, I would say, a sterile environment like an operating theater. In fact, in many places around the world, if a spinal is necessary, either for diagnostic purposes or for a simple injection, it can be even done in the treatment room, which is clean and sterile. Right? So in Gleneagles, we do it in a proper sterile environment, and the patient is also monitored during the whole procedure. Okay. Now, with regards to spinal again, almost every patient every patient that has a spinal injection actually walk out of the treatment area within an hour or 2 hours. That shows how safe it is. It's not only just adults. I have done many smaller kids, even up to about 2 to 3 years old. Even doing a spinal injection has no severe adverse problems. Doesn't need any intensive care or resuscitation of any sort. And they can actually leave the treatment area also within 2 hours. So in skilled hands, especially for people like me who are trained to do a spinal injection, it is a very safe procedure that we can deliver stem cells into closer to the brain. All right, and this is what we think it will help any neurological conditions. All right. Now the next step will be, what are the possible side effects of cell therapy? If it's intravenous, usually we don't expect any major issues with cell therapy, except that of course we must be always aware of any kind of allergic reaction, because cells are cells, they have protein, they are actually not from the same patient, they are allogenic, that means from a different source. Just like medication, food, anyone can get allergies. So we are always prepared to treat any kind of allergies with regards to even stem cells and exosomes. With spinal in particular, because we're injecting directly into the spinal fluid, which then the cells will then travel to the brain, we would expect some kind of side effects or effects that can be seen. For example, like fever. Now, some individuals, whether adult or child, may have fever, and the fever can be mild, moderate, or severe, and depending on the severity, we will treat accordingly. All right. Now, if it's severe, we will advise to give stronger, I would say, fever medicine like paracetamol, ibuprofen. All right. And with adequate fluids, usually the fever will subside over the 24 or 48 hours. The other side effect of a spinal injection will be like headache, which even if you don't have Parkinson's, but you're coming for an operation, it is a common possible side effect. Headache, nausea, vomiting. Yeah? And sometimes if it's a little bit more severe, you might get a little bit of lethargy, a bit tiredness for the next few days. But in my hands, no patient has to be admitted to the hospital after a spinal injection. All right. Most of the time, the side effects can be taken care of at home, out of the hospital or out of the clinic.